Good day, dear students. I am assistant of Department of Pediatrician Dana Gabdullah. Today's lecture's topic is borderline conditions of neonatal period. The borderline conditions are states of adaptation of newborns to life outside of the womb. The main borderline conditions are transient hyperventilation, physiological jaundice, physiological erythema, toxic erythema, physiological loss of primary body weight, transient features of kidney function, transient polycythemia, sexual crisis, physiological dyspepsia, and transient hyperthermia. Borderline conditions are not occur in all newborns, may be incomplete or absent. Sometimes they may appear only in premature babies, and they can be detectable only by laboratory data without clinical symptoms. First breath and transient hyperventilation. Immediately after birth, mostly metabolical changes like hypoxemia, hypercapnia, and acidosis stimulate the respiratory center. Newborn starts his first breath. Transient hyperventilation includes the following processes: high respiratory rate above 60 in 1 minute, gasp type breathing in 4 to 8% of newborns. Lungs are filled with air and released from the fluid, and losses shown between pulmonary and systemic blood circulation, which worked during intrauterine development, will be closed. Newborn skin is pale, cyanotic, somewhat edematous, and covered by hair, lanugo, mostly in the shoulder blades. Also, skin of newborns covered by primordial lubricant, which include exfoliation of the epidermis, fat, cholesterol, etc. When skin will be cleared from lubricant and after a few hours after birth, skin becomes to reddish color with cyanotic tint. It's called physiological erythema. This physiological erythema can be present up to 2 days, mostly in preterm infants, and it will be normal transient vascular reaction to outside life. Toxic erythema mostly occurs on 2nd and 5th day of life in 20 to 30% of newborns. Characteristics of toxic erythema. Localization. They are mostly located around the joints, thighs, buttocks, chest, abdomen, but never on the palms, soles, and mucous membranes. Character. Mostly they are red in color with gray-yellowish vesicles of the center. Number of spots mostly single, or they can cover full body. Duration mostly 2-3 days. Physiological jaundice of the newborns. On the 2nd or 3rd day of life in most children, the skin acquires a yellowish tint. This is due to high reduction of fetal RBCs and immaturity of the liver enzymes. Physiological jaundice of the newborn. Typical bilirubin levels. Mostly in the 3rd or 4th days, level of bilirubin 100 to 140 millimole per liter. In 1/3 of newborns, it's lower than these numbers. In 1/3, the number of bilirubin can be more than 170 milliliter per liter. So clinical symptoms like jaundice may be seen in 2/3 of newborns. In full-term babies, skin color will be yellow if bilirubin level will be more than 50 millimole per liter. In preterm, 85 to 100 milliliter. Mostly this physiological jaundice disappear on the 7th to 10th day after birth. But if jaundice will be present more than 1 month or around 1 month, it will be a conjugational jaundice of newborns. Transient hyperthermia. It's on the 3rd, 5th day a newborn's body temperature may increase above 39.5. Causes of hyperthermia is mostly overheating, room temperature more than 24, bed near heater, direct sun, or inadequate fluid intake. Physiological loss of primary body weight. In the first days, body weight of newborns can be decreased up to 6 to 8% from initial body weight. Reasons for weight loss: mostly low intake of milk, high energy consumption due to activation of organs and systems, insensible fluid loss from skin during respiration, urine and meconium passage, and drying of the umbilical stump. Transient features of kidney function. There are some functions disorder of the kidney which we are telling like borderline. Signs of anuria: the absence of urination with about 20 hours after birth. In 10% of newborns, it can be about 24 hours. Oliguria: a decrease in the amount of urine occurs in all newborns in the first 3 days. Transient features of kidney function. To determine the required daily volume of urine that a full-term baby excretes in the first week, there is the following formula: 6 to 8 milliliter multiplied into day of life multiplied into body weight of the newborn. Transient albuminuria. Albuminuria mostly happens due to tubular and glomerular permeability increasing. That's why patient can have these clinical symptoms. Albuminuria mostly detectable by laparoscopic data. Uric acid infection, result of catabolic metabolism. High uric acid level occurs in 1/3 of newborns by the end of first week. Urine mostly cloudy, brick yellow color. In microscopy, we can see leukocytes, epithelial cells, and casts. Disappear by end of the first week, and this will not damage kidney tissue because it's transient condition. Transient polycythemia, increase in the amount of hemoglobin in the blood more than 220 gram per liter when normal is 180 to 220 gram per liter, and increase hematocrit level. Sexual crisis. Desquamative vulvovaginitis, it can be seen on first 3 days, occurring in 2% of newborn girls. There will be gray-white discharge from the vagina, resolves in 2-3 days. Engagement of the mammary glands appears on the 3rd, 4th days, results by end of the first month, neonatal period. Characteristics: normal or mildly hyperemic skin, symmetrical swelling, diameter 1.5 to 2 cm, when pressed, grayish milky secretion. Metrorrhagia, vaginal bleeding about 1 milliliter, occurs on 5th to 8th days, lasts duration about 1 to 3 days. Often in children after birth, on the tip and wings of the nose can be determined white, yellow, pinkish color spots with size 1 to 1 millimeter, like millet grains. Physiological dyspepsia. It's stool disorders. During first, second day, sometimes 3 days, patient can have meconium. After, there will be transitional stool on the 3rd, 4th days. The frequency of discharge increases, and the stool is characterized by the following signs of physiological dyspepsia: consistency, mostly liquid, watery, wet spot on diaper. Color, heterogeneous color, white, yellow, light-like, or green. During microscopic composition, there can be contains mucus and lumps. Thank you for your attention.